I'm at the American Hospital Dubai, where I'm going to meet a specialist in pediatric care with over 15 years of experience. And she's going to tell us everything that we need to know when it comes to healthcare, taking care of your children, and what's most important. Come follow me. Please do tell us, what is it all about when it comes to children's health?
So thank you for having me today. So yeah, I mean, one of the most important things that you probably need to focus on is screening and education for parents. I think this is one of the most important things to address usually, so we can prevent, not only treat.
Now, of course, a lot of new parents, young parents, always a little bit worried or maybe overcautious when it comes to their children's health. What advice would you give them?
So I would say I would give them the main advices, like for example, basic newborn education, like how to feed their babies, how often they need to feed the babies, how to take care, for example, of the newborn, the umbilical cord. This is like one of the most questions that I usually get in clinic. Also, if it's a male, like how to take care of circumcision site, get educated on things that we usually see in newborn babies, like for example, jaundice, colic, reflux. So I think there has been a lot of changes for me, like that I've seen during the last, I would say 10, 15 years. So I think there's like more focus on mental health now, like there's like more mental health issues. I see kids like more with anxiety, ADHD, whether it's because of, I would say social media or academic, like achievements that has to be on par with other kids. How we do screening more for those kids during, like the visits, especially in something that we call an MCAT, certain questionnaire that we usually do for kids during their like 9 months, 12 months, 15 and 18 months. So that if there's like any issue or any problem, we can catch it before.
And when it comes to, again, let's say focusing on the medical side, what are you maybe seeing on a daily to day more, recurring when it comes to the medical side or when it comes to children?
In my clinic? Yeah, so like we see a lot of nowadays, like, or in general, like I would say respiratory infections, like this is one of the most common things that we usually see on a daily basis, like common colds, I would say bronchitis, bronchiolitis. Usually treatment is supportive measures, make sure temperature is taken care of, see pneumonia also, and we usually prescribe antibiotics if needed for that. Ear infections also is one of the most common things we usually see, especially in toddlers. Gastrointestinal, like infections, like viral infections, gastroenteritis, and we usually give them, also supportive measures, make sure they're very well hydrated, and temperature, if they have, it's, it's taken care of. Health visits, make sure that vaccination is taken care of. Any issues that the parents have are very well addressed. Also, I would say allergies and asthma is one of the most common things that we also see in clinic.
Great. Well, doctor, thank you so much. It's been a pleasure. We learned quite a bit today, especially when it comes to healthcare and it comes to children. And we'll look forward to you more in the space. We had a great chat today with Dr. Rawan, especially when it comes to pediatric care. Taking care of children today is a very vital and important thing. Of course, come and get your checkups at least once a year for your child, and as well, stay healthy.